Welcome to another episode of Med Madness. In today's episode, we will delve into the ethics surrounding the refusal of treatment and the termination of the patient-physician relationship. This topic is crucial for medical students as it addresses the delicate balance between professional responsibility and ethical considerations. Understanding these principles is vital for providing compassionate and ethical care, while also protecting the integrity of the medical practice. Today, we'll cover the guidelines for terminating patient care ethically, explore various considerations and options, and conclude with a real-life case study to illustrate these principles in action. Next, let's discuss the ethical guidelines that must be followed when terminating care. First, physicians must notify the patient in writing about the termination of the patient-physician relationship. This ensures clear communication and documentation of the decision. It is essential to offer to provide care for a reasonable, finite period, such as 60 days. This allows the patient adequate time to find another provider, ensuring continuity of care. Physicians should provide instructions for the patient to obtain a copy of their medical record or to have it sent to their new provider. This facilitates a smooth transition and continuous medical care. Terminating care during a medical crisis such as an acute illness, post-operative recovery, or a complicated pregnancy should be avoided to prevent abandonment and ensure patient safety. Now, let's discuss some additional considerations and options that physicians may have. In specific circumstances, implementing a corrective action plan, like a payment plan for accrued debt, might be appropriate for otherwise conscientious patients. However, if the patient's deceptive behavior has compromised the therapeutic relationship, such plans may not be effective and could lead to further hostility. If inappropriate behavior and deception have already affected the therapeutic relationship, dismissal should be initiated promptly rather than waiting for the patient to leave the practice voluntarily. Providing general information such as a medical society directory or hospital referral line is suitable. However, directing the patient to a specific provider could lead to mistrust by the patient of the new provider. Immediate termination of care should be reserved for unusual circumstances, such as violent or threatening behavior, severely inappropriate actions like sexual misconduct, or criminal activities involving the practice, such as theft. Let's consider a real-life scenario to illustrate these principles. Dr. Smith has been treating Mr. Johnson for several years. Recently, Mr. Johnson has been repeatedly missing appointments, falsifying information about his medical history, and displaying hostile behavior towards the office staff. Despite attempts to address these issues, Mr. Johnson's behavior has not improved. Dr. Smith decides that it is in the best interest of both the practice and Mr. Johnson to terminate the patient-physician relationship. Dr. Smith writes a formal letter to Mr. Johnson explaining the decision and offering to continue care for the next 60 days to allow him time to find a new provider. The letter also includes instructions on how Mr. Johnson can obtain a copy of his medical records. Dr. Smith ensures that the termination does not coincide with any medical crisis, thus avoiding abandonment. By following these steps, Dr. Smith upholds ethical standards while ensuring Mr. Johnson's continuity of care. In today's episode, we've covered the ethical guidelines and considerations for terminating patient care. We discussed the importance of written notification, providing a finite period for continued care, facilitating access to medical records, and avoiding termination during medical crises. We also explored additional options like corrective action plans and the conditions for immediate termination. Remember, handling these situations with sensitivity and adherence to ethical principles is crucial for maintaining trust and integrity in the medical profession. For a comprehensive understanding, be sure to engage with the pre- and post-podcast quizzes and utilize the Anki flashcards provided. Thank you for listening to Med Madness. Stay tuned for more insightful episodes to help you excel in your medical journey. You've been listening to Med Madness. Don't forget to visit our website and subscribe to our channel for more episodes. Join our community and engage with the interactive content to reinforce your learning. See you next time.